Good afternoon, everyone. My name is Petra Zape, and I'm MCHEM Healthcare Committee Policy Expert. It is my pleasure to welcome you at today's webinar. Today is powered by Roche. We are going to talk about the topic future-proofing healthcare, the sustainability index, which is trying to look at the data from the healthcare systems and compare them. Lots of topics of today's discussion are linked to healthcare committee work. And I'm very happy that Roche has been part of a long-time partner of many projects of healthcare committee. Just to have a look at some global health indicators, on the positive note, we can see that there are many indicators, such as child mortality or life expectancy. These numbers have been improving over time. However, if we realize nearly 100 million people every year are pushed to the poverty because they cover the healthcare expenses out of their pockets. There is also half of the populations that don't have access to the package of basic healthcare services. There is a lot of pressure on the rising expenses to the healthcare. There is aging population, and we need to start to look at a different way at the healthcare system and how the healthcare systems deliver the outcome for the patients. We need to start to change the way we see and also approach the healthcare. We need to move from the healthcare that is hospitality and curative system to the healthcare that is more preventive. We need to move from the healthcare that is vertically seamed, and we need to move to the healthcare that is more multi-stakeholder approached. We also need to move from the healthcare that is fully fragmented system, and we need to go to integrated system with the data interoperability and with data-driven decision making. So it's my pleasure to welcome here the great lineup of panelists. Please let me introduce Daren Wilson, that is a Roche country manager of Roche Slovakia. Daren, welcome. Daren will lead and moderate today's discussion. And I'm very happy that Daren is actually the one standing behind the idea of the webinar, of the topic, and also lineup of the speakers. Welcome, Daren. Our next guest is Martin Smatana, head of the Health Policy Institute of Ministry of Health. Welcome, Martin. We are happy to have you. The next speakers that you are going to see on the slide behind is Andrei Nahkala, that is Public and Communication Lead Europe, Roche Switzerland. Welcome, Andrei. And Boya Elizen, Director of Health, Copenhagen Institute for Future Studies. So before I hand over to Daren, please let me inform you about some organizational issues. We are going to discuss over 1 hour, 50 to 60 minutes. We are going to have presentations, and afterwards we are going to take the Q&As from you, audience. Please send your questions during the whole discussion. You can send your questions on the chat that is on YouTube, but you need to have an account in Gmail, or you can also use Slido. You can see the hashtag on the screen. So please don't hesitate to send us your questions, and we will try to respond and out loud respond to your questions. Thank you and enjoy the discussion. Daren, I'm handing over to you.
Great. Thank you very much, Petra. And also thank you to AmCham and the AmCham Healthcare Committee for the opportunity to have today's discussion on future-proofing healthcare. For those of you that are joining us virtually, Dobry den, welcome. And for our speakers joining us online, thank you for the contributions you will bring. And then also to Martin Smatana joining us here in studio, also thank you and a warm welcome. As Petra mentioned, my name is Daren Wilson. I am the General Manager for Roche Slovensko, and I have the unique privilege of moderating today's discussion, which will be a dynamic, data-driven discussion about the Future-Proofing Healthcare Sustainability Index for Slovakia. As a brief introduction as to why Roche is behind this topic, obviously healthcare sustainability is very important for us. We at Roche believe it is our collective responsibility to ensure good health and well-being for citizens all around the world of all ages. This is why, like the Slovak government, we are strong supporters of the UN Sustainable Development Goals, specifically number 3, good health and well-being. We at Roche also care deeply about the Slovak healthcare system, and we do believe in its promise and potential. Already there's been a lot of very positive actions being taken to develop a vision for Slovakia, most recently with the new government mandate and also with the 2030 Healthcare Future initiatives that have been developed by AmCham. And these are 2 initiatives that we strongly support as an organization. I'd also like to inform you that in Slovakia specifically, our company, Roche Slovensko, has been undergoing a transformation so that we're in a better position to provide a better contribution to Slovak society. Under new leadership in our Roche Pharma division, we are now moving towards a purpose-driven, agile organization. And our purpose here in Slovakia is to help to improve the healthcare system in order to deliver better outcomes to more patients faster. This is why we're taking an active interest in investing into the future of Slovakia. We are working to bring personalized healthcare to Slovakia. And most recently, we've initiated an investment into healthcare startups as a way to help to accelerate and support Slovak innovation for the purpose of improving healthcare. And if you are interested to learn more about our initiative behind healthcare startups, you can go to the website at www.healthcarelab.sk. So with this introduction, I would like now to hand over to Andrei Nahkala, and Andrei will be introducing the Future-Proofing Healthcare Index. So Andrei, the floor is yours. Thank you.
Thanks a lot, Daren, for the introduction, and thank you for the opportunity to talk about the Future-Proofing Healthcare Index a bit more in detail and talk about the background of the index and why it was created. And as Daren mentioned, Roche wants to be one of the data that has been created comes from Roche. All the data, European Commission, Eurostat, World Bank, UNICEF, the likes. Those are the data sources, and in total we have around 100 data sources feeding into the index. On top of that, the decision how the data is used, it's not Roche's decision. It's the development of the index, the creation of the index was driven and is driven by a group of Roche external people. So there are leading patient organizations across Europe. There are NGOs and different health policy institutes contributing to the creation of the index. And today we have an opportunity to hear from one of them, Boye Eliassen from Copenhagen Institute for Future Studies. The index, as it is an index, it gives a score for all the countries in Europe, how they perform in different elements of the healthcare system. It measures each of the pillars on a scale from 1 to 10, and through the index you can really do a deep dive into what feeds into the index scores. And I must say that everything on the index is publicly available. It can be visited at www.futureproofinghealthcare.com. On that website, you can do a deep dive for your country. You can do a deep dive into different elements of the index. And when we measure healthcare sustainability, the pillars that the group of experts recommended look into are access, healthcare, health status of the citizens, and then how country adopts innovation, the quality of the healthcare system, and resilience of the healthcare system. Those make the 5 pillars of the sustainability index, and each one of the pillars contain number of third-party data sources that are then converted into a format of an index. The index is an interactive platform. As said, it can be visited on futureproofinghealthcare.com. I encourage everyone attending this webinar to go after the webinar to the website and find the index there and do some research on the different elements. And what we also are working on together with the experts is to create a place for discussion, a place for change of views from the expert to talk about what really means, what makes the healthcare sustainable and how to move forward. So you can find a number of opinion articles on the platform as well. And ultimately, if you think what this is about, it's not about Roche, it's about all of us who are partners or players in the healthcare system. It's a tool for all of us to focus on discussion and drive forward healthcare-related reforms and discussion, not based on opinion, but based on data. So ultimately, we hope that the tool that we put together with the group of experts will initiate data-driven policy change for the benefit of the patients and the citizens. With that, I'd like to hand it back to Daren.
Thank you very much, Andrei, and thank you for the introduction to the Future Proofing Healthcare Index. As we hear from you, this is a data-driven approach to understand the correlation of different countries across a number of different metrics on how well they're doing in the field of healthcare. So to give us a better understanding of the Future Proofing Healthcare Index for Slovakia, and to review some of the top-line findings, and we will be using these findings as the basis for moderation and discussion. I'd like now to hand it over to Boja to give an introduction of yourself and to walk us through the Slovak data.
Thank you very much, and thank you for the invitation. Yes, I'm Boja Eliasson. I'm Director of Health of the Copenhagen Institute for Future Studies. The Copenhagen Institute is an independent, non-for-profit institution, and we work very much in between public and private sector, in between different countries, and we do a lot of knowledge brokering as well. But the basic point here is to have decisions made on data. On the other side, we work on moving decisions from emotion to facts, to make data and insight accessible, to building broad coalitions for change, enabling leadership for change. These are core things we need to have in place if you want to work with data for health. So when we go to Slovakia, as Andrei was explaining, we have the sustainability index, which is built on this 5 pillars, being access, health status, innovation, quality, and resilience. So we have parameters inside each that we then compare and look at. And as you can see, Slovakia is number 22 in these. And before I go further into these, Daren will take some first looks at some findings on Slovakia.
Thank you very much, Boja. So initially, we're giving a little bit of a teaser to the top-line findings for Slovakia, and Boja will actually walk us through some of these findings in more depth. But in order to get the conversation started early into this presentation, we wanted to take one of the interesting and promising findings for Slovakia, and this is on mental health status assessment. And here we see a very favorable ranking of Slovakia in Europe, ranked 4th out of 30th. So at this opportunity, I'd like to invite now Martin Smatana to maybe just give some of your thoughts and interpretations as you see these findings, these positive findings for Slovakia. What does this say about Slovaks?
Right. I mean, I wish this would be true. And I think that one of our colleagues from Ministry of Finance, Lucia Grajterová, she's also online, and she wrote with her colleagues a nice paper, which was also published as a part of the Value for Money 2 document, which exactly focused on mental health and mental health status in Slovakia. And actually, they also came to very strange finding that on paper, in international benchmarks, it seems very good. However, in practice, it seems to be a underreporting issue in Slovakia, which is linked to a social stigma in our society. In fact, in 2019, a professorka called Ms. Bražinova, she published a nice paper which claimed that nearly 85% of people suffering from anxiety didn't get treatment because they were too scared to either admit it or they didn't actually know they suffer from anxiety disorders. 80% of people who have issues with alcohol, they don't get any treatment, and roughly 70% with a depression, they just don't even contact the doctor. So an issue here seems to be that we are too afraid and we have a stigma to admit that we have a mental issue, and that's why we don't get treatment, and that's why probably it doesn't get reported, and that's why it seems so positive. I really like the paper because it really focuses the discussion to one of the most because when they looked into what are actually the real expenditure on mental health or mental health related problems, so they came to a conclusion that in fact up to 2.3% of GDP can expenses can add up to 2.3% of GDP, which is roughly 1.8 billion of euros. Out of this amount, roughly 480 million euros are directly health-related expenses, not only on direct treatment, but also related issues, because if you don't get treatment at sufficient stage, then you have some complications. Roughly 600 million euros are direct expenses which are related to social support that you need to get because you suffer from a mental disease, and roughly 800 million euros we have a loss of either productivity or we have great unemployment, etc. So altogether, this is one of the greatest issues in Slovakia, even though it doesn't look like that on international scale. Yes. So.
Okay, very good. And I think you raised some important points, because obviously in the index it works with data that is publicly available, but you just cannot stop at the data, and it does require the societies and the governments to look further and to better understand what is behind the data and what is driving, and then this becomes the platform for good policy making. And it's evident as well in this discussion that in Slovakia, despite having these findings, there's a lot of deep understanding about what the true issues are, and that's a great starting point to be within a country. So that was a way to kind of start the conversation moving. I'd like now to hand it back to Boya. And Boya, if you could just walk us through some of the additional findings for Slovakia.
Yeah, so if we take the access point, we can see that Slovakia is 23 of 30 countries. So that's in the lower end, but we can see that, for instance, in operating theaters, Slovakia is number 17, and genetic newborn screening number 16, but in access to MRI, it's 23. So there are some things where we can see Slovakia more or less in the middle of Europe, but of course a part where Slovakia is in the lower end, which we then can use to look at where do we need to focus. If we then go to the health status on the part, we can see that Slovakia is very high when it comes to tuberculosis and HIV/AIDS. And we just got a different explanation on the mental health, so I won't mention that more. But then it's very low on chronic diseases. And the mortality on cancer on one of the lowest, which also, of course, is a point to working on. And going forward to the quality, we can see a good standard in concern of hospital infections. The income-based health gap is quite low, but avoidable mortality is quite high. So there are still things to look at. And when it comes to resilience, we can see Slovakia being number 20 of 30 as well as before. And here we can see, for instance, graduations of pharmacies, which leaks a bit into the sustainability of the system on a longer term. It's okay, number 6. The age dependency project is very low on the 3rd place. The number of doctors, I think under 35 is on 13, and nurses on 8. But the gender gap is very, very high, as well as the expenses for preventive measures on that part. So we can see there is a huge focus on the action on disease in the system, or maybe less on what was explained in the beginning, on how do we make the sustainable system where you also do a lot of the things outside of the hospital.
Great, thank you very much, Boya. And I think also you were raising a point, and just for the audience to help them understand and put this information into perspective, is that in an index, these are composite endpoints. So there are a number of different metrics that help to build the score for any given European country. And within that composite, there will be elements that will be, in some cases, very positive for a country, as an example in Slovakia, and then there will be other measures that may be not as favorable, and it is the combination of all that helps to gain the score. So let's maybe start to dig a bit deeper into this data and try to make some sense out of the interpretations. And again, it's with great pleasure that we have Martin with us, who can help us to understand a little bit more. So when thinking about the quality, which is one of Slovakia's best ratings, and then also resilience was also relatively positive for Slovakia, both of these metrics putting Slovakia in the top 2/3 of European countries. Here we see some interesting findings. So here we see a balance in the ratio between the elderly and the youthful population, and obviously this is encouraging because you have an economically viable part of the society being able to support the elderly part of the society. And another interesting finding for Slovakia is the number of physicians under the age of 35, which is very encouraging to see a ranking of 10 out of 30. Caveat to this, obviously, is that there is the discussions, obviously, of brain drain and sometimes the loss of physicians to other countries. So when we think about sustainability in Slovakia, we need to also think about the retention of the young talent. And then here also in parts that warrant discussion a little bit more is where Slovakia is indexed in terms of nurses per 1,000, where we're 23 out of 30, and then obviously in the overall practicing physicians. So on this part, Martin, I'd like to again bring you back into the conversation and just thinking again about these metrics of quality and resilience and some of these parameters that are contributing to that rating. How do you interpret this data, and from it, what do you think should be a potential focus for Slovakia in the years to come?
Right. I would start with the old age dependency ratio, which is rather interesting from two perspectives. One of them is that, according to EU Commission, we will be one of the fastest aging country by 2070. Our expenditure, only because of the changing of the dependency ratio, will increase at least by 1% of the GDP just because of the age. The problem there is that even though as of today we look rather good, the problem is, and this is very difficult how to explain it without getting to get it correctly explained, is that we have a problem with that the fertility, the new babies, are by great extent driven by, we call them marginalized communities, which are in most cases the Roma population, who there is a separate paper, a separate revision, separate value for money, only focused on these groups of population, and it says that even though they tend to have more children, or they are to a great extent driving the population growth, they are also that part of the population who has the lowest health status. On average, the infant mortality rate is 3 times the average of the country. When it comes to the life expectancy, on average, males tend to live 10 years less, and women 7 years less than the rest of the population. So even though on paper this looks good, when you look into the details and you split between the marginalized communities and the rest, you see that this is actually really worrying, in fact. So it is, as of today, good, but we expect it to be worse. And if you look into details, there are several other consequences which will cause several other issues. I'm very glad that we have value for money focused on this type of area of society, because we now know where exactly to focus our policies and measures and projects. Because if we help this group of population, to grow, to get better, to improve, we get in all other areas much better, right? Relating other measures, I really like the nurses per 1,000 compared to the doctors. The funny thing is that when it comes to both of them, we did a survey in October 2019, and we've asked all providers as to how many nurses or doctors would you like to have in order to be in, like, let's say, optimum provision, optimum state. And the result was rather, well, close to each other. We are lacking rather 3,000 doctors and 2.6 thousand doctors and roughly 3,000 nurses. However, when we looked into the future and we did some modeling, we've asked also the hospitals and inpatient providers and outpatient providers, and we came to a number that by 2030 we are likely to lack 10,000 nurses and roughly 3,000 physicians. So physicians seem to be, when it comes to the overall number, fine, but the nurses, we expect them, the number of the shortage will further deteriorate. When it comes to the doctors, another funny finding is that on overall, when we look into the different specialties, some specialties tend to be very fine. Some specialties actually even overpopulated, when I can call it that. And then we have some specialties like a GP or pediatrician or anesthesiologist who seem to have the greatest shortages. So we have several groups of physicians or several specialties which tend to be much more in a problem than the rest of them. We did we've implemented several measures and projects since 2017 which aim to stabilize these numbers. We will see how it goes, but I personally see as the nurses as one of the biggest issues in the years to come, because the shortage is likely to further deteriorate, and it's very difficult to stop, considering how long it takes to educate a nurse, and also considering that if we, for example, increase average salary of nurses, other countries are very likely to do as well, because that's exactly what happened with Czech Republic last year and the year before that. So.
Okay, thank you very much for that perspective. If I also heard you correctly, I think you brought some important topics to the table. One about the harmonization of equality and the same standards of healthcare throughout Slovak society, which is an important topic that already you've clearly addressed, and you're putting appropriate policies in place, and knowing and continuing to do so will obviously help for the betterment of all Slovaks. And then more so is also thinking forward into the future about the future needs of Slovakia. If we want to see this resilience score be maintained or even improve, I think here also you're finding some interesting areas of focus, particularly putting the concern and effort about making sure we have the right resources of nurses, and then also for the physicians, as you mentioned, aligning the specialties so it's best adapted and the specialists available to meet the needs of Slovaks in the years to come. With this, Boya, I'd like to invite you also, just because you've been involved with the future-proofing healthcare and you have a pan-European perspective. What is sort of your take when you look at this data, and how might this correlate to rest of Europe?
Yeah, it's quite clear that we see Europe in 4. The biggest divide is between East and West, and then we also have the North-South. And of course, there are different history and different cultural parts on it. And when it comes to the eastern part, which Slovakia also is a part of, we can see there are some clear environmental or behavioral things that we need to look at in most of the countries. We also see a lack on the data side, also on the research and biobanking, if we compare to the especially northwestern part. Mm-hmm. But on the other side, what has been raised on the Slovak part, if we really want to stand strong on a European level, and the idea is to go with a more personalized digital and biology-driven health paradigm, every country is too small to stand alone. So this is also where we can use a tool like this, where we look at the countries, we can compare the countries, we can begin to see best practices, learn from each other, and from there also have a much better reason to have standards and interoperability.
Very good. Thank you for that. And I think the topic of borderless collaboration in terms of healthcare and public health measures becoming much more a topic of interest in our COVID world as we exist today, and we do see the importance of better collaboration across various partners. So it will be quite interesting in the future to see how this evolves for us in the European Union. Also, in taking a look here around bringing a correlation between access and mortality and preventative measures, we see that Slovakia is in the back end of the 1/3 for access at 23. But also kind of interesting is in mortality of cancer, we're ranked 28th out of 30 in an index, and in preventative expenditure, we're 28th out of 30. And maybe before just jumping into this topic, I want to first take a quick pause and talk about Slovakia in terms of the response to COVID. And here, obviously, Martin, the government and the healthcare system and healthcare providers have done an outstanding job in managing the crisis of COVID in Slovakia. And I think for all of us here living in Slovakia, we've felt very safe and appreciate the competencies that have been put to making sure that this crisis didn't become something of what we've seen in other countries like Spain and Italy. Now, there's probably a lot of learnings that could come out of this COVID experience, and we don't want to lose sight of other important diseases that are still having impact in Slovakia. When we do look at the non-communicable diseases like cancer, we are seeing these lower indexes for Slovakia. So we wanted to maybe bring the discussion to this a little bit. And with that, Martin, I would really appreciate to have your understanding, how do you see this picture? What's your interpretation? And then, from your perspective, what do you think needs to improve?
All right. So I will probably start with the access issue, because this is rather also entertaining. Because we've also looked into what is the access to MRIs or CT scanners, etc. And yes, it is true that if you compare us against the rest of the EU, you can see that we don't have that amount of CTs or especially MRIs. However, then when you look into number of examinations per one machine, it is not as bad. So which means that we do probably more examination per one machine than. So yes, in terms of probably physical access, it is probably worse, but when it comes to the efficiency of the machines, we are probably better than the rest. This started in 2016 when we published the first value for money report. The conclusion was that we need to reduce the price per treatment, and the way we did it is that we reduced the price per treatment, also the volume of the deals, and it resulted in an increase in number of examinations which companies had to do in volume of the money they had. The problem we have when it comes to the access, and you mentioned diagnostics, is probably, and it is true that in terms of both the number and treatments, we really lag behind the rest of the EU, and we know that PETs can have, if administered at a sufficient stage, they can be very, very beneficial. Then I would like preventive expenditure. Yes, it is true that we spend, I think, that 1/3 of the average of the rest of the countries, and this is probably one of the biggest issues in our country. And you've mentioned COVID, and it is true that we managed so far. We've managed to battle the COVID very well. but I would say despite these numbers, so it was not helped by this. In fact, I believe that if we really focused on, as I said, the mental health and other preventive measures, we can really get greater improvements in the health status and in other measures that you mentioned previously. And as far as I know, that I believe that the current the Ministry of Health and the people there really would like to focus on prevention and all the communication and the stuff which can reap greater benefits. The reason why we are one of the worst countries in the EU is that, well, since you invest today in people, you reduce more the body mass index, reduce sugar intake, and in fact we published a nice paper with the Ministry of Finance which really tried to implement some measures in terms of reduction on sugar intake. It didn't succeed, however. The problem is that you implement it today and you get results in 5, maybe 10 years. And considering how many times we had a change in the ministry, like average lifespan of our minister is 2 years, which is not sufficient. So very few people actually spend time and invest into this topic, whereas it should be one of the priorities that there are. And lastly, the mortality on cancer, I think it is closely related to both the topics. If you don't have sufficient preventive measures, you are very likely to get or diagnose the patient with a treatment at very late stage. And since, as I mentioned, today we do much greater numbers of examinations, but it was not like that a couple of years ago. And also we don't have sufficient amount of the numbers and the examinations for PETs, which means it is all related to, and the mortality on cancer is just an outcome of these two problems.
Very good. I would like to maybe build a little bit later on the preventative expenditure, because as we think about a post-COVID world, maybe less focus is going towards curative care, and much more focus in the healthcare societies will go towards prevention and prediction. And obviously, to be able to be capable of doing that, we're going to want to talk about the necessity of the data infrastructure that is set up in a country. And so we'll go into that conversation in just a few moments. But again, thank you for sharing this perspective. Boya, from your standpoint, do you have anything to add to Martin's assessment?
I think it's a very good assessment, and to me, it shows the value of coming with working with indices like this, because we want to be a knowledge society, but if we don't have the data to build the knowledge on and compare and look over time, it's going to be very hard. And especially the point which Martin comes with, that you seed today, but you harvest in 5 or 10 or 15 or 20 years. That understanding we also need to get in. And then it also means for people like us who work long-term with health system, that we also need to learn to work with health ministry and not necessarily health ministers.
Okay, thank you very much for that perspective. Let's bring this conversation to another way of looking at it, and so we're going to talk a little bit about outcomes. And so here we've taken some metrics where we have life expectancy. I think it's 25 out of 30. We have the mortality of cancer at 28 out of 30, and then we also have amendable mortality. And for those joining us online, amendable mortality is preventable death for diseases that typically can be treated, like diabetes or appendicitis as an example, and Slovakia is indexed at 25 out of 30. So these are obvious outcome measures in the indexing for Slovakia. And then just to kind of give it some flavor and context, we looked at the expenditure per capita in healthcare in Slovakia, and we see a relative favorable rank for Slovakia at 19 out of 30. But what's interesting is the discrepancy between the expenditure that is going into healthcare and the outcomes in these metrics that we're seeing for Slovakia. So hence this raises the question, does healthcare in Slovakia need more money or more efficiency or both? And so Martin, it would be great to have your perspective on this question.
Right, so this is the one of the biggest topics we've had since 2011. In 2011, Ministry of Finance published a paper which says that we don't get let's say I'm not sure how to translate exactly, but the outcome was that compared to the rest of countries, they looked into several comparative measures. The conclusion was we do not get sufficient outcomes considered how much we spent. In 2012, 13, and later on, other NGOs, universities, they looked into the methodology, and they've looked into other things that you need to compare among countries, such as the poverty rate, the Roma population, other areas, and they come to conclusion that it seems that we are within an average of other Visegrad countries, which would say that yes, even though individual measures do not look well as straightforward, but if you go into in-depth methodology, you would come to a conclusion that we actually spent comparable in terms of the outcomes. When we looked into this last year, we didn't manage to publish it yet because we didn't have time. It seems that actually compared to other countries, we seems to be even more efficient, a bit more efficient, but it is mostly related to the fact that in 2016 we started with the Value for Money project, and we got some actually very good results in 2017. Then 18 and 19 were not as good, but we have a new Value for Money which was meant to be put in place this year. However, COVID changed absolutely everything, and we will have to see later on what the outcomes in terms of the expenditure will be, and also in terms of other avoidable mortalities, etc., etc. So my perspective is that if you look into other areas that need to be considered when you compare the expenditure and health outcomes, such as I said, the poverty and Roma population, we are not doing as bad as it might seem. However, also based on what we've seen during the coronavirus, that actually we were lucky because we didn't have sufficient number of servo ventilators, we didn't have sufficient number of all the protective gear, we didn't have hospitals which would be of sufficient level of let's say safety prepared from the first day, because what's the average age of the buildings of our hospitals? I think is 35 or 40 years old, and according to European Investment Bank, we have a capital expenditure gap of roughly 6 billion euros. I would say that we need to invest into healthcare, but the question is where, and that was exactly the focus of the second Value for Money report, and the idea was to improve allocative efficiency, which means to rather spend, as we said, the mental health, public health, focus more on primary rather than specialist outpatient care, and we've pinpoint several areas where we believe that if we start investing today, we won't see results next year or in 2 years' time, but maybe in 3, 5, or 10 years, we will see that we've moved into areas which add value rather than areas which get you short-term results, but in long term will cost you actually more.
Okay, thank you. And as we're listening to you, it's evident that in Slovakia, the Value for Money initiative is a very important initiative, a very important policy guide for where best to put the expenditures to help the overall healthcare in Slovak society. And maybe we can move the discussion a little bit further in the sake of time and talking about this value of money. So when we were looking at these outcomes and thinking about the outcomes in Slovakia, and when we think about Slovakia, the healthcare system, are we a cost-based system or are we an outcome-based system? What I was hearing from you is that the foundation for moving towards an outcome-based system is being established in Slovakia. I think that's a very positive approach. And when we were looking at what outcome-based healthcare considerations could be, one of the main aspects is the validated high-quality data registries across disease areas or across different populations in terms of therapeutic interventions. And obviously this is important. If you are going to make an investment of €1 today, how will that translate 5 years from now? We need to obviously be positioned to accommodate that. And then the other aspect is about data transparency on health outcomes, so that this is regularly affording the opportunity of a society to adapt and tweak their policies so that they can be getting the best efficiency out of spend. And then also in terms of clinical evidence, where decisions are being driven through evidence-based decision making. Here as a local one, it's also about data sharing and how is the data flow occurring and how can that be best optimized for the benefit of the patient. And then when we look at drug reimbursement policy, how can we start looking at drug reimbursement policy for the sake of achieving and improving outcomes, and if we are, what needs to change? And obviously that also affords an opportunity for personalized healthcare. So the question you've already answered a little bit, but maybe we can just kind of elaborate a little bit further, because the question was, how ready is Slovakia for an outcome-driven healthcare system? And as we heard from you from the previous conversation, the foundation with the value for money is the right start to help to shape the appropriate policies for this. But maybe just in consideration of these different topics, maybe could you elaborate a little bit further in terms of how do you see our readiness, and what else do you think can be invested into or focused on in Slovakia to move towards this kind of healthcare system?
All right. So you said very correctly that when we started doing the value for money, we were actually the first ministry. We moved towards looking into what is the value of any measure that we do. What we actually need, or actually still lacking, is a stability. One of the biggest issues that we see that we have free health insurance companies, to private and public, and let's say that we negotiate budget on every year on every basis, and sometimes twice per year we actually add up some extra money because there was an issue and it was not sufficient enough. It's very difficult for them as entities who are responsible for purchasing of the care, they're procuring health services. It's very difficult for them to actually really engage in value or medium or long-term value-adding activities, considering that they can't predict the amount of resources for a particular year. You can change your health insurance company once per year, which leads to the fact that, let's say, I would invest into a more expensive pacemaker, which would last longer, and you don't have to see doctor every 3 months, but every 6 months, because you have a digitalized access to it. But you can change your company, which means that there is no stability in the fact that I invest in you and I will get a benefit because you are healthier. So on paper we are getting ready, but we then have several big issues which we need to solve before we can actually really claim that we are actually a healthcare system which is based on a value-adding measures or practices.
Okay, very good. But I still think it's very encouraging that the foundation's being placed,
Yes,
and
sure,
obviously this is the starting point for any country, and it's a very positive development for Slovakia. And maybe, Boya, from your perspective, from a European perspective, I'd like to bring you back into the conversation. And what is some of your perspective on this, and how are you seeing this with other European countries?
Yeah, I think generally we have been working for some years from several sides to get an understanding of that we need to think more long term. Our health system understanding is more or less 100 years old, and it has been focused on acute care and accidents in that way. What Martin is explaining here is also a realization on how do we make this sustainable over time, which means that we need to work with things where we have earlier access, earlier interaction. And as it also was mentioned in the beginning, the situation with COVID has changed the way we can discuss on can we take money out of the hospital and work earlier in the process. So I think the opportunity is to take that first, to make that change, has never been bigger than when we are going to move to the post-COVID area. If we manage to do it, depends on how well we can work together, because it also means that we need to work in much better ecosystem and also across boundaries and across public and private. But that we openly discuss that this is the next need, and not just discuss is there access to health services right when you need them. That shows quite clearly that we see a big push forward.
Thank you very much for sharing that perspective. And again, you keep on bringing up the topic about helping to support and build a broader ecosystem that could potentially even extend borders. So we're hearing this message from you, and obviously the importance of the collaboration and partnerships that will be needed to support the health ecosystems. In consciousness of the time, I just want to see, Petra, if there was any specific questions that maybe we can offer to Martin or Boya.
There is one question that is addressed to Martin Smatana, And are all the data, Martin, especially those related to mortality, cancer, and preventive care, reflected by the Ministry of Health governmental program?
Not sure which governmental program though.
Let's say long-term.
I need to focus. Well,
Strategies.
when you look into how the money is actually allocated into our sector, and we actually move 5 years back into the past, what we got that time was a bunch of resources, let's say 3 billion euros, and it was up to health insurance companies to spend it. Since 2017, thanks to the help of Ministry of Finance, we moved into more or something that we call a, let's say, a program budgeting, which means that we have several programs and we would like to invest into it. The way how we did it this year and last year was that we've defined different types of care, such as inpatient, outpatient, rehabilitation, whatever, and then we set at least what we expect the health insurance companies to spend or invest in, right? The ideal would be that we wouldn't be doing this in terms of types of care, but in terms of diseases. Let's say that we would increase expenditure on, let's say, C18, which is the colorectal cancer, or C50, which is either lung or something like that, right? So this is something where we wanted to move, but we are not there yet. So we have the data, but as a Ministry of Health, what can we do about the data, right? The only way how we can actually make things change is actually that we will motivate or we will force health insurance companies as procurers to do something about it, because we can invest into something, we can buy new machines. What we did, we bought 18 linear accelerators, for example. But when it comes to something which will actually really impact patient in sustainable way, we need to define our policies in terms of diseases. And this is something where we wanted with the Ministry of Finance move this year, which means that the budgeting for the forthcoming years would be done in terms of not only types of care, but in terms of the groups of diseases which we will find as the most important. And this is something I believe as a part of the group that want to really emphasize influence and impact of public health will be done. So we will see what happens in a couple of weeks and months. We have a new minister, new team. They came into very complex situations considering the COVID and Corona, so it will take them probably a couple of more months to get accustomed to this situation, but I really hope that this change in the way how the budget is done will be implemented.
Okay.
Martin, I just would like to add one question. For this, we need higher quality of data. And majority of the country, maybe Boya, this is also a question for you. Majority of the countries do collect the data, but they don't use them properly. What is the country in European Union or in your index that could be an example of high quality of the data in healthcare?
Yes, I guess I should answer that. It's important that we, when we look at this index, that here the data has gone from the countries to some OECD or WHO or others. So we're trying to align different data sets. So that's one side of it. What we are then doing is that we are trying to make it easier to access and see data, because if you want to take all this data that we have on and have presented today, you have to go into many different repositories and it becomes very hard to work with. So that's one side of it. The other side is, of course, data quality has to be at the first priority if we want to use a data-driven health system. I'm of course biased, but the way we collect data in the Nordic countries is probably better than in the other places. But it's not just because you collect them, it's also because you have the repositories, you set up the quality repositories also to follow up on treatment. So it's not just about do you collect the data, it's do you put the functions where you use the data, because that feeds back to why should you collect the data.
Very good.
Thank you.
Thank you. Thank you for those insights. So let's move to wrapping up our program. We'll take an opportunity, Boya, if you could just walk us through the innovation finding.
Yes. So if we take the innovation, we can see that It's a low score, 28 of 30. And one thing I would say, collaboration in life science is on a 10th place, so that's on the higher third, which is good. But one thing to think about going forward is that the access to e-health is extremely low, and we will not go forward with data without having a prioritization on the e-health part. And this is also very much an infrastructural question, which is on the health system, but not just on the health system.
Thank you for that. I mean, in fairness to Slovakia, many of the Central Eastern European countries tend to be relatively low on innovation. This is an area of opportunity and development in Central and Eastern Europe. And you did mention the access to e-health, and here we're ranked 25th out of 30. And obviously, as we've talked about data and high quality data, this is an important aspect to that. Furthermore, in overall research and development in Slovakia, we're relatively okay at 22 out of 30, so there's some opportunities here. But maybe we could use the concept of healthcare as being an investment. We do know, and there's economic data to show that if you can improve the amount of lives lived within your society, that has a direct correlation to improvement of GDP. And also thinking about Slovakia and the future as we look to see what are possible recession-proof industries that could be a possibility. I thought maybe let's look at healthcare, and here I guess, Martin, I'd love to have your perspective, being in Slovakia and as a Slovak. What do you think about the possibility in Slovakia of investment strategies, either to help to establish a biotech industry, or maybe because, again, there's a lot of bright minds and Slovakia is very rich in technology, to establish a health technology industry in Slovakia?
Right. I mean, this is a topic which we spent plenty of time with Dr. Kvietikova. She is the head of the the department responsible for innovations in our ministry. And I would probably start with the spending on R&D and to actually explain why we are actually 22nd. Well, if you look, generally speaking, spending on R&D in general is very low. And if you look into EU Commission, they do a report on annual basis, which is called Innovation Union. We are, I think, the 5th worst in entire EU. And in fact, if we deducted the number of PhDs as one of the measures which add up to the big measure, we would be the 2nd lowest in the EU. So unfortunately, it is more about the overall governmental concept of whether we should be doing our own R&D rather than the issue which is only in healthcare. Even though we've had some very successful startups, we are one of the countries which developed their own PCR test for COVID, which means that we have very good teams that would be responsible. And this was actually one of the areas that Dr. Kvietikova wanted to actually invest in, and she had a very good idea which was about to be implemented, which was to build a large centralized biobank, which is actually not yet in Slovakia. So we are still in the, let's say, we have some infrastructure, but we are still missing very important links in the entire chain. And up until that is done, I think that our role can be on very small niches or very small areas that we can do. As I said, we have Mr. Čekan, we have several other good scientists who have actually received several EU awards. Other than that, I think that we have a very good potential in R&D in artificial intelligence. I think that one of the, I'm not sure if I can name the company, but it's a German producer of CTs and MRIs. They have their own development centers for software, I think, in Košice. So we actually are doing very good on this area. It is not directly biotech, but it is, artificial intelligence, which I believe is future. And we as a Slovaks can actually really play a good role in this one. Right.
Very good. And I just want to build on that because I think that's also one of the aspects that for myself, being an expat and a foreigner, attracted me to Slovakia, is that this is a very technologically rich country. There's a lot of potential here. And on the AI, we see the importance of AI in healthcare going forward with a lot of AI augmented support and clinical decision making and such. So the ingredients are definitely in Slovakia for establishing, and hopefully, as you mentioned, maybe some of these small initiatives have the opportunity to blossom and attract also more interest in the area and can help to build towards a better prosperity in Slovakia for this industry.
Yes, actually, I can add up to that, as probably the listeners probably know that I am about to end my 5-year journey at the Ministry of Health. And one of the reasons is that I really believe in Slovak AI, and me and 2 other colleagues are actually setting up a startup which is actually focused on AI in healthcare. So I personally really believe that we have a potential and we can actually deliver great results and added value. So yes, as I said, we can do it for sure.
Okay, perfect. And again, Roche welcomes you to also, if you're ready, participate in our healthcare startup lab, where we are looking to support Slovak innovation with startups. So with that, I'd like to maybe just have final impressions and last words. And in this time, I'd like to switch it around. So Boya, I'd like to offer you your final impressions of future-proofing healthcare in Slovakia, and then we will hand it off to Martin to give final word.
Yeah, I think it's very important to have in mind that we are entering a paradigm shift, which means that a part of it is, of course, to make things work which are not working well enough, but it also the opportunity to be a leader in forming the new paradigm where AI, as mentioned, data in different ways, the behavior side of health becomes more and more important. So we should also see this as an opportunity to be a part of framing the next steps.
Great, thank you, Boya. And Martin, your final impressions for future-proofing healthcare in Slovakia, and also anything you would like to draw out in your comments as potential next steps?
Well, relating to all these initiatives, I'm very glad because when it comes to composite indicators, there are very few. I mean, if you remember what happened to the WHO 2000 report, I mean, they published it just once and then they stopped publishing. So since then it was very difficult actually to measure, let's say, or to rank the healthcare systems. And all we have left is the Bloomberg Health Index, which is more focused on the healthy aspect. And then we have the Swedish, I'm not sure where they're from, the Powerhouse Index, which is more focused on, or they have great emphasis on subjective feelings of individuals. So I'm very happy that we have a composite indicator which looks into it, because it can help us to get a snapshot as to where we are, where we can get compared to the countries that we actually deem ourselves as, as a competitors. So I'm very happy that this initiative came to Slovakia. I really hope that it will get even more public recognition, and that when it comes to maybe future changes to the value for money report, maybe we can actually also comment on that, because as you know, our key indicator today is the preventable mortality and then the spending per GDP. So from this perspective, I'm very happy that you did also Slovakia and that we could meet today and discuss, and I believe that it will spread and the people will acknowledge that this is one of the things that we can use to drive the policy making.
Great, thank you very much, Martin.
There is one more question from Martin Slegel. Can I read it out?
Sure.
Great webinar, Roche team. Well done. Quick question. Do you see need for more robust RWE registries for major therapies in Slovakia? Greetings from Prague. I think it's for you, Martin.
Real-world evidence data for the need for more real-world evidence data in Slovakia in terms of registries and such.
For major therapies.
Well, you know very well that this also been one of the topics that we've been very heavily involved in, and we try to publish all data we can. I mean, this issue is very, very complex. In 2017, I will just be very quick, the National Center for Healthcare Information, which is responsible for all data, they were supposed to embark on a project which was aimed to streamline all the data sources, because some of them doctors still have to manually input, and to make one repository out of which different agencies or different stakeholders would get an access exactly into real life data. It was in 2017, it was supposed to be implemented, or the project was supposed to start in 2018, then 19, it's 2020, and has not yet been started. So yes, I'm completely aware that we need those data. We have them somewhere in the system. All we need is just to streamline it agree on what the general principles for the access and transparency are, then do it. Because as you know, as of today, we've been doing it in our institute. If somebody asks, we've prepared the data, we compiled it and we send it. But even though we try to help, this is not the way how it should work, because this is not, efficient, and this is not, way how an government organization should work. So I completely agree, and I really hope that this project will continue, or that there will be another project which will supplement it, because we believe that it's not that much work and the value added is immense.
Yes. Thank you, Martin.
Great, thank you. So maybe in conclusion, this was a great opportunity to have a data-driven discussion about the merits of the healthcare system in Slovakia, and to talk about the different possibilities to create some future-proofing initiatives in Slovakia. I think why we're all here, and for the audience dialing in as well, is that healthcare is of significant importance for us, for our children, and for our future generations. And if we look at healthcare as an investment, we see the necessity of this for the prosperity of Slovak for the years to come. We hope that today's discussion is one additional building block to help to continue the efforts in Slovakia to work towards data-driven, outcome-driven healthcare. And hopefully that this information can be an excellent platform that can be used for the betterment of healthcare. So with that, I would like to thank Martin, yourself, and for the opportunity to have this moment with you before you move on to your new adventures in life. Also, Boya, thank you very much for bringing your perspective, your expertise, and European viewpoints to the discussion. And also, Andrei, as you've been behind this initiative for quite a long time, thank you for your leadership in championing this so that we can bring meaningful data discussions to countries from around Europe. With that, thank you, Amchan, and thank you to all of you that joined us today. If there are any questions that we may have missed, we will do our best to respond. And with that, I wish you a wonderful day. Thank you.
Thank you.